All right. Thank you, everyone, for coming today. I wanted to introduce Ginger Healy, who joined us from the Attachment and Trauma Network. With over 20 years of experience in the field, Ginger has served as a child abuse investigator, hospital social worker, and the director of programs at the Attachment and Trauma Network. Ginger is a respected speaker and travels nationwide to share her expertise on trauma sensitive educational environments, therapeutic parenting, and community engagement. Additionally, she is the author of Regulation and Co-Regulation, Accessible Neuroscience that Brings Calm into the Classroom. So please join me in extending a warm welcome to Ginger as I hand it off to her.
Thank you for that, Sadie. I really appreciate that. I'm so truly honored to be here today and share space with you all. Um, you've already kind of got me emotional because as I was watching the chat and who was entering the room, I saw that many of you are also LGBTQ advocates, and that is so near and dear to my heart. I have 4 children. I have 2 children who are LGBTQ, and I have 2 autistic children, and I just have a heart for vulnerable populations, and I'm a sexual abuse survivor myself. And so I just love entering spaces with people who are of like minds, like hearts, mission aligned, and who are doing the work. And so thank you for that. Thank you for all you're doing. And I'm grateful to be here and network with you and join together with you. I'm putting this slide on the screen for a second here because it's got my email address. And I want you to have my email address and reach out to me if you have questions, if you want to troubleshoot a case, if you want to say, I tried this and it didn't work. What else do you recommend? I am available for that. So there is my email address, and I freely give that to you to connect in this great work. So let's go ahead and dive in because I often find that I have too much information and I want to come at you with like a fire hose, and you don't have to absorb all that. Um, just take what you can and take what you need and don't get overwhelmed. But I also do want to say as we get started that this work is hard, which you already know. Um, but this topic can really be triggering not only for those who have obviously experienced abuse and you're working with them, and so you're kind of handling that delicately as to not re-traumatize and re-trigger. But what I want to pause here for a moment to say is that as we talk about this, it may also stir up feelings and emotions inside of you for different reasons, for different people. And just notice that and be aware of that. And then take care of yourself if you need to step back, if you need to take a breather, if you need to stop and come back to it later. That is so important to be aware of. So just know that too, that may happen. I'm going to put in the chat. Um, let's see if I can be slick about this. Let's see. Here we go. Here's what I'm going to put in the chat for you personally as a resource as well. Oh, do you know what? I apologize. That's not what I wanted to put in the chat. Oops. I knew that if I tried to be tech savvy, I would here, let me pull it down and see what
I
now it
removed the other one for you.
oh, it's so interesting. Here, it was a phone number, and maybe I'll either try again or I'm just not sure how I messed that up. Um, I'm going to give it to Sadie as a resource. I've given Sadie a lot of resources that she's going to put in the chat and that she will give to you via email. This one was one that I hadn't given to her, but I will give to her. But it's you personally having a helpline, a 24 crisis line for professionals. I don't think that we can underestimate the impact that this work has on our souls. And in fact, I was at a conference the week before last week and talking to another therapist who has been studying what's called moral injury. Moral injury has been studied in um, military and PTSD, war survivors, as being talked about as something that when you have to uh, make a decision on the behalf of the greater good, but could hurt someone as you make the decision, it can cause injury to your soul. It's called moral injury. That has been studied deeply in our military. But what we are finding now is that therapists, mental health professionals, um, educators who are directly working with children who have experienced adversity, abuse, that if we are working in a system that also harms, which sometimes education does or our court system does, that it's working for the greater good, but you're also it can be traumatizing to testify in court, right? Or to anyway, what I'm saying is that it we can experience moral injury ourselves. So, I'll at the very end I'm going to wrap up how we can care for ourselves as child serving professionals, but I just felt like I needed to say that up front as well. So, I'm going to give that information to Sadie too. I'm going to continue to dive right in, but sometimes I get a little sidetracked and go where I'm feeling like I also need to speak. So that was a little bit of a sidetrack, but I think it was important. All right, I'm going to start off giving you some foundational information that you may already have, but I feel like it bears worth repeating or going over. I'm not going to like dive deep and spend a lot of time on this, but I feel like I really want to build up to the strategies I want to give you to implement and why, because there are a lot of strategies out there, and I want you as child serving professionals to fill your toolbox, but not everything is going to work. And so I want to tell you why certain strategies will work and why they won't, so that you can better target your intervention for these kids and youth and help them in the best way. So I'm going to start back at the very beginning and define what is trauma. Now, I think that people think they already know what it is, but what we're finding is that there are many different kinds of trauma. What I'm specifically going to be talking to you about today is what is called developmental trauma. That is trauma that happens to someone as they are growing and developing. So we're talking about children because there is a lot that happens from 0 to 18 with the brain and with the nervous system. And of course, physically, there's a lot of things happening and happening at a rapid rate. And trauma that happens to you before you are an adult changes you differently than trauma that happens to you um, post that age as an adult. And the other thing about trauma is that it happens, whatever happens is not what we're talking about. Sometimes people think that the event is the trauma. You were in a car accident, that was traumatic. What I want to say to you is yes, and it's not just what happens to you. It's not just the event. It's how that event affects affects you. It's the event, the experience, and the effect. So it's something happens. How do you experience that? And because of that, what happens after? What are the effects after? So the event, the experience, and the effect. And when we're talking about children, it is different because children don't have the same amount of control. they are more vulnerable. They are still developing and growing. That prefrontal cortex part of the brain isn't fully formed and developed till adulthood, and not even early adulthood. We're talking like age 30. So, well into adulthood, we are still developing that prefrontal cortex. The brain develops the whole entire lifespan. Great news, right? It's called neuroplasticity. We can continue to grow and shape and mold brains well into adulthood. I can learn a new language as an adult. It's harder for me, it takes longer for me, but I can still do it, right? I can still grow new neural pathways. That's neuroplasticity. But what happens in childhood is that that brain is growing and developing at a much more rapid rate, and the neural pathways are being formed and being shaped and more moldable and malleable. So that's for good and for bad, depending on what happens to you. So trauma is just psychologically distressing. It overwhelms and it involves fear, terror, and helplessness, and can have lasting effects that cause long-term, consequences. And so that's what we're going to talk about. Especially if we're talking about sexual abuse, it's not just the event, the actual assault or abuse, it's how that event now has sensitized, either over or undersensitized the nervous system and rewired the brain, right? So, what we're going to be talking about today is targeting the brain, and our strategies and interventions need to be directed at where that child is at in their brain. And I'll explain all of that. And then how to soothe that nervous system that is now oversensitized, or in some cases, undersensitized. We have to activate the brain and the nervous system to work together in a healing pattern rather than what could be now what we're seeing as symptoms and behaviors that have resulted. We're going to heal those and rewire. Um, the other thing I'm going to say here about trauma is that we can't judge it, we can't predict it, we can't say, well, that child, it wasn't as scary or it wasn't as traumatic, right? It wasn't a big deal. We don't determine that. That's not in our wheelhouse to say that that was a big trauma or a little trauma, or why are they struggling so much? It was only one time, or it was over the clothes, so it wasn't as bad as under the clothes. We can't say that. We can't make the determination. Not even the child can make that determination. The nervous system makes that determination. And there's a lot that goes into making that determination. The age, the so many things. What happened prior, what happened after. It's an evolving thing. So we don't judge it. And you'll hear this. And I'm sure you've already heard this in your practice. It wasn't a big deal, or it wasn't as bad as that other situation. We have to wipe those statements out of our vocabulary, because what is traumatic to one may not be traumatic to the other. And in fact, two people can be abused by the same person for the same amount of time, for in the same way, and they will have different reactions. And there's no shame in that. I think a lot of victims oftentimes will say, well, I should have handled it differently, or it shouldn't be still impacting me, or it shouldn't be bothering me. I hear this in adult survivors looking back saying, I wish I would have, or it wasn't, now looking back, I don't think it was that big of a deal. All of that, there's shame surrounding those statements, and we just want to pull that shame out of it and let them know that what happened to you obviously was not your fault, and how your body biologically responded you was not your fault. You're not in control of this is what happened. And so we move from there, taking the shame out of it. So I just want to spend a half a second on ACEs, understanding what an ACE is, an adverse childhood experience. And being sexually abused is an adversity in childhood. If you were abused as a child, that is an adversity, right? Obvious, we know this. What you need to know is that the more ACEs, the more adversities that you experience in childhood increases your risk for things in the future. Okay, so there are many different kinds of adversities that can be experienced in childhood. Today we're focusing on sexual abuse. But it's not what happens when a child is sexually abused is not just that one thing. Many different things can happen after that. If the abuser was in the home and now the abuser is removed from the home, even though that is something that maybe is absolutely the right and best and good choice to remove that abuser from the home, we have now created another adversity because we have moved from, say, for example, a two-parent home to a one-parent home, which now increases the risk for poverty, and for other vulnerabilities, right? It wasn't just the one ace. Now we've got two, possibly three, right? It's like a domino effect. So that's something important to know about aces. The other thing is that adversity in childhood, unfortunately, is very common. At least one-fourth of the population has experienced at least one adversity. And because of that, what understanding ACEs is understanding that it's not then a doomsday, it's not a diagnosis, it's that it puts you at higher risk. So the whole thing about talking about ACEs is that you just need to be aware of that, that now because of adversity, you or whoever you're working with is at higher risk. So the awareness is that now that we're aware of that, we've got to do something about that. We can change that. It's the higher risk puts us at higher risk for physical problems and health problems like cancer, stroke, heart attack, diabetes, if left untreated, if left unchecked. Emotional problems. Um, we often see that those who have experienced high adversity in childhood are at higher risk for job loss, for relationship problems, divorce, and mental health problems such as anxiety and depression. This is very serious. This is something that we have to be aware of. That the more adversities you experience, the higher risk you have, and so the more support, resources, intervention, and things like what we're doing today. What do we do to stop this? Because there are 40 million child sex abuse survivors in the United States, right? And we don't necessarily know if that is perfectly accurate of a number because of how many go unreported. The numbers are staggering, right? And so 1 in 5 girls, and I think that number is higher. And I've heard 1 in 3, I've heard 1 in 4, but what we can show 1 in 5 girls, 1 in 20 boys. So, and I think you know all of this, but I think it's important to just remind that. The other thing that I wanted to point out is that there oftentimes when we talk about child sex abuse, we tend to talk about an adult and a child, but what we're now also learning is that as many as 70% of children who are abused by a peer, by someone who is under the age of 18. And so um, there are studies on that, and I can link that to you, but that is also absolutely staggering to me. And knowing that we treat that differently, we talk about that differently, we understand how to intervene differently, especially when it comes to prevention, which we also want to look at. But just as a general overview here, what I'm talking about is when I talk about sexual abuse is physical contact. Yes, absolutely. But also without physical contact. So exposure to another's genitals, but also exposure to pornography, voyeurism, child pornography, exploitation online, sexting, um, and videos, anything like that. So understanding that being sexually abused as a child can put you at higher risk um, for adversities in adulthood, the physical health problems, the mental health problems, and the emotional problems. What we do know is that adversities in childhood, especially including sexual abuse, changes the brain. So it impacts the wiring and development. And I probably won't spend a lot of time on what that looks like today. I think what you need to understand is this slide talking about normal development in our neurons. And we're talking about these children who are every day growing, learning, and developing their brain, right? That if there is a chronic stress, then those neurons and neural connections become damaged. They don't fire as regularly or strongly, or they misfire. And I'm going to talk about what that looks like, but super important to see a view of what normal neural pathways look like versus pathways under toxic stress and how they deplete and erode and actually get pruned away in the body. Okay. And then one more thing I just want to point out as we're talking about brain development is that if I think we all understand that, you know, any type of abuse um, will impact that brain development. But what is often not understood is that if that child in the womb prior to birth, what happens in the brain, let me go back and explain this first and it'll make a little more sense. When there is stress, our bodies control the stress, try to manage the stress, combat the stress through the body releasing stress hormones into the body. Those are called neurotransmitters, and they can heal, they can energize, they can comfort, they can do so many different things. Now, if that mother who is carrying a child in her body experiences that stress, that chronic stress, those stress hormones will cross the placental barrier and impact the brain of the fetus. So that is really important. I did not understand that. I was never taught that in grad school. And when we're talking about brain development, we may be working with children who have had their brain development impacted prior to birth. So if you're seeing children in your office who are, when it comes to big behaviors or behaviors that like everything was fine and now it's not, right? They go from 0 to 60 really fast and you're trying to figure out what the trigger is what happened. It is very possible if they come from a background of stress, poverty, and high adversity from their parents or others, but particularly from birth mom, and not necessarily of her fault. If she was like, if you have a family where there is domestic violence and mom is impacted while pregnant, those stress hormones will have crossed that placental barrier, sensitizing the nervous system and affecting the wiring of the brain. We have to know that because sometimes our treatment methods, when they're not working, it's because it may have happened, the damage may have happened prior to birth. So we target that differently. Okay, so let me get into that a little bit more in talking about stress because I'm using words that I'm using the word sexual abuse, but when I also want to couch it in terms of stress, right? Or adversity. I'm talking about the same thing because when it comes to the internal part of the body, it's being impacted, whether it was specifically child sexual abuse or stress or other adversity. The nervous system will respond and the brain will get rewired in that same way. And it's all very much overlapping with each other, right? So when I'm talking about the event being child sexual abuse, there are also other things happening. Like now, what's happening with the caregiver situation once the abuse has been disclosed? That's something else. That's another stress. That's another activation, right? What was happening prior to the abuse? What else is happening in the home, right? This interconnected environment. I'm looking at other adversities and other stressors because it's impacting what is happening, how the abuse is being processed, and, are we going to court? So many different things, right? And so we're not just looking at the event, we're looking at everything else that's going on. We're looking at all the systems coming into play that are impacting this child. You're not just going to treat the child, we're working with the caregiver, we're working with the school who is working with the child, right? So we have to keep in mind this big picture. So here's what, going back to stress, what I want to share is that there's different kinds of stress. There's positive stress, right? We have to have a reason to get out of bed in the morning. We have to have that alarm goes off. That's a little bit of stress, but it goes away and it gets us to the other side. If we didn't get out of bed, we wouldn't grow, we wouldn't thrive, we wouldn't overcome challenges. We have to be able to have moments of stress where we have to problem solve and overcome that in order to grow and strengthen and become more resilient. We cannot bounce back from challenges in our life unless we've had a lot of little challenges that practice that, right? That's how we get stronger. That's how we build resilience. So we have to have that positive stress, like right before the football game or right before a concert where you're performing, you're really nervous. But if you stopped and didn't go forward with it, you wouldn't get on the other side. So you get on the other side and you're like, oh, that was scary. That was hard, but I did it. Right. So moments of stress that we overcome strengthen us. And how do we do that? How do we tolerate the stress? It has to be buffered. It has to be cushioned. So, like, say, for example, you had a really hard day. What do? You talk to your spouse or you talk to a friend, and it buffers that, it cushions that. And even bigger, harder things like divorce or job loss or a diagnosis, we can survive those things if we have support and resources and connections that buffer that stress. So, again, earlier I was talking about stress hormones and neurotransmitters. When we have something stressful happen, our body tries to help us and protect us by releasing stress hormones in our body, adrenaline and cortisol. And that adrenaline, it speeds up our heart rate. It dilates our eyes. It opens our ears so that we can figure out and problem solve what to do next. So say, for example, I mean, this is kind of an outrageous example, but if we're walking along in the forest and we encounter a bear, we need to either fight that bear or run away and get away from that bear, right? And so what our body does, it detects threat and it detects danger. Ah, there. That's threat and danger. So the body says, I'm going to help. I'm going to give you some adrenaline. That will give you the ability to run faster than you would have been able to do without the adrenaline, because you're going to want to either run as fast as you can away from the bear or gather enough strength to actually fight the bear. That is a physical need, and you're going to need adrenaline to do it. Now, if you cannot fight that bear physically because it's too strong, or you can't run fast enough away or hide, fast in a way that gets you safe, then you don't need adrenaline. What you need is cortisol because that will shut you down and you can freeze, deer in the headlights, and you can play dead until that bear hopefully leaves you, right? So those are stress responses: fight, flight, and freeze. And our body helps us do that when there is danger or threat. Now, what happens is if you fight the bear, kill the bear, right? Or run away from the bear and get away, or freeze and play dead until the bear leaves, then you have survived that threat, that danger. And then what do you do next? You're probably running away to safety. Like in caveman times, right? You'd run away and you'd get to your safety and you'd get to your family and you'd close the door behind you and you'd go, and your body would let out a visceral sigh. And the act of doing that, what I'm telling you is we need those stress hormones, but we only need them for a short period of time. And so our body does what is called a stress cycle, detects the danger, fight, flight, or freeze from the danger. And then our body is pumped with those stress hormones, adrenaline and cortisol. We survived, we don't need them anymore. And now we've got to get them out of our body. We don't need them anymore. So, how do you do that? You go to your friend, you lock the door, and you do that sigh and your body releases them. You hug your friend. Oh my gosh, that was so scary, but I survived. And your friend hugs you, and the act of saying it out loud and the act of affection and understanding that you're safe sends the message to your body: the stress is gone. Get rid of the adrenaline and cortisol. She doesn't need it anymore, right? You cry. There's all the things that you do after a really scary incident, say like a car crash, you go into shock, that's the freeze, or you get angry and irritable, that's the fight, or you don't want to talk about it, you want to avoid it for a minute, that's the flee. And then when you're ready, you talk about it with someone, you work it out, you problem solve, you go to the hospital, you do all the things that you don't even think about that are in this cycle, in this stress. And then your body goes, okay, no more adrenaline and no more cortisol. Then you have fully completed that biological stress cycle. And you are back to a baseline of regulation, steadiness, health. And you're like, "Whew, I'm okay." This is what your nervous system is doing. I'm okay. And then your brain goes, okay, I can work now. I can function. Because in the moment of threat and danger, the brain does a lot of different things, right? It's trying to problem solve, but it can't until it knows it's safe. But what happens if the bear is in the home? What happens if the bear is in the school? What happens to a child who is being sexually abused? And that is the bear. And the bear is still there, right? Well, I'm going to tell you what happens. The body senses threat and senses danger. Someone is hurting us. So I need to either fight that person. Can I? Sometimes yes, sometimes no, right? Oftentimes no. Okay, so fighting isn't going to work necessarily. So what about running away, hiding? Maybe temporarily, but maybe not. A vulnerable child can't, right? So the other choice is like shut down, freeze. Well, Well, what happens is that the body is saying she needs adrenaline. He's got to be able to fight or run away, and continues to pump the adrenaline until that supposedly, right? The theory is until the threat's gone. But if the threat never leaves, then the adrenaline keeps pumping and the cortisol. She needs to freeze until that threat is gone. So keep giving her cortisol. And because that threat is possibly never leaving or is happening for days, months, years, the body is flooded with stress hormones, adrenaline and cortisol. And because of that, it starts to poison the body. That's why it's called toxic stress. It's toxic. And what does that look like? A lot of different things. It can look like um, stroke. It can look like cancer. It can look like heart attack. It can look like diabetes. Those are the ones that manifest later in life because of the buildup of the stress hormones. It can look like irritability, can look like sleeplessness, can look like brain fog, inability to focus. It can look like anger, combativeness, skipping school, procrastinating. It depends, right? We don't necessarily choose how our body responds. You will see kids that are just angry, right? Or just mouthy. They are yelling, they are screaming. You will see kids who are fearful and anxious and not able to talk or express their words. They're not able to think clearly. They can't follow multi-step directions because that takes a part of the brain that they don't have access to if the threat is continuing. You'll see kids who are just deer in the headlights, who are frozen, who are staring out the window, who are unresponsive. And then as a fourth stress response that you may or may not be aware of, you'll see kids who, what we call fawn, who appease the threat, who befriend the threat, who try to make everything okay to stop the threat, right? Because they feel safer, closer to the threat, that they can maybe control it more because they're completely out of control. So these are stress responses, and oftentimes they are completely misunderstood, completely mislabeled, totally misdiagnosed, right? How many times have you heard from a teacher or a parent or even thought yourself, because I certainly have been guilty of this, they're so lazy. They are so disrespectful. I hear this one a lot with children who have been sexually abused. They're so manipulative. Well, what if they are so desperate to control their out of control circumstances that they do try to control them, and it totally looks like manipulation. And maybe it is, because that is how they think they can best survive. This is all about survival. Think of the bear. It really helped me to put it in perspective. If I was looking at a bear, oh yeah, we got to survive this bear. Okay, the bear is sexual abuse. How do we survive the bear? Even if the bear is gone, even if the abuser is in jail, even if the abuse has stopped, the body doesn't necessarily recognize that. They still detect threat and danger because maybe there's a possibility the abuser can come back. Maybe there's a possibility of a new abuser. Maybe, who knows? And oftentimes, especially when we're talking about brain development, the brain now has been in a pattern. There have been neural pathways formed that say, you're not safe, because that is their truth. They were not safe. So, how do they really, truly, how does the body really, truly know that they are safe now? They don't always. And so, even though we can say till we're blue in the face, you're safe now, it doesn't mean a thing. It doesn't necessarily resonate. I'm going to teach you and talk to you about how to get there, but we have to know that just saying that doesn't mean a thing. If the nervous system is still firing, still detecting threat and danger, and the body is still swimming in adrenaline and cortisol, then it doesn't matter that you say that they're safe. They don't believe they're safe. They don't feel that they're safe. So that's what I'm talking about. That if we don't understand stress responses and why they're happening, then we oftentimes will misdiagnose. We will misdiagnose a child who does not want to sit still because they can't feel safe. We'll misdiagnose them as having ADHD. We'll misdiagnose learning disabilities because a child can't perform on a test because they're staring out the window, right? And then what happens with misdiagnosis is that we're maybe prescribing medication. If the medication isn't working, then we've got a misdiagnosis, and it could be because we're not understanding stress responses. So, I want to spend just a second on fawn again, because when it comes to sexual abuse, that's the number one stress response that I see in a child is fawn. And it is so completely misunderstood. This is where kids get misdiagnosed as attention seeking, um, and self-sabotaging, right? And what oftentimes is happening is that they're just connection seeking. They're seeking safety through safe relationship, but they're finding it in other places. They're so needing to belong and be accepted that they will seek that in unhealthy relationships. This is where I see a lot in high school. And oftentimes you'll hear me when we talk about sexual abuse say she, but please don't misunderstand that I am talking about girls and boys. But when it comes to fawning, most stress responses of fawn are from girls. It's just biologically what happens. Doesn't mean that it doesn't happen in boys, but very common. And now that if you haven't heard of it before or seen it before, you'll see it everywhere. So just be aware of that. I'm not reading every slide, so go back and look at those. You'll have access to that. Okay. Stop me if you have any questions or if you want to explore further. I'm going to keep moving along. I want to share with you just a little bit about attachment, because this is another area where we don't always understand what's happening in a behavior or a response that happened due to early childhood experiences. So, when we're born completely dependent, right? We're vulnerable. We have to have somebody meet our needs. And so that's what a caregiver does. They meet our needs several times a day, right? A newborn baby has needs constantly and consistently that have to be met by a caregiver. And every time that that caregiver recognizes the need and meets the need, something happens that we're not even aware that happens. And that is that the infant starts to build trust and an understanding that if they make their need known, their need will be met. And in a larger scale, on a larger scale, what is developing inside the infant is a deep rooted belief about themselves and about the greater world around them. Now, if the need is met, then they start to build trust and think, someone cares about me. I matter. I'm worthy of love because that's my truth. Someone cares about me and someone's meeting my needs. But if abuse occurs, and that can be neglect of needs not being met consistently, repetitively, predictably, or there's a rupture in the need, like abuse, physical, sexual, emotional, otherwise, then the infant or child or youth starts to mistrust others because harm has taken place. And even though this harm may have taken place prior to them being able to recognize it, understand it, express it, um, it is impacting how they feel about themselves and the greater world. When that happens, they start to think, I actually don't know if I'm safe. I'm not safe. I must not matter. My needs must not matter enough. I must not matter enough to have my needs met and to be kept safe. Um, I'm not worthy and I can't depend on anyone else. I'm going to have to just take care of myself because I cannot trust anyone else. And so you'll see this, and I'm sure you already have kids who are just ruggedly independent. They will not allow help. They don't want help. They have this big wall in front of them because they don't trust others. And you're thinking, I'm safe. I'm here to help you. I want to help you. Let me in. But they still have put up this wall and will not let you in. It's not personal. It is not you. It is because of what has happened to them. And it makes sense. And so our job then is to recognize that and understand that. And I'm going to show you how to break that wall down in a way that is safe and can be and you can unblock their what they're blocking, your bids for connection, right? The other thing that happens with these kids because of abuse is that they start to look at the outside world and say, we've talked about this whole trust issue, but that the world itself is not safe. And so it goes back to this feeling of control. So when you see kids that just seem like they are so desperate for control, this is often why. So I will refer back to this a lot because what you're seeing in your office oftentimes go back to this. Now I've got this baby on the screen and it starts very early on. If there was an unpredictable environment very early on where needs were not consistently met, this is already building this mistrust and this inner working model of self-worth, right? So it's not just the abuse, because some of our kids who have been abused have come from environments where there was a lot of instability and unpredictability that will greatly impact them. And after abuse is disclosed, that shifts their environment, right? Nothing is the same now. Now we're entering therapy. Now we're in a court system. Now there is a change of caregivers, right? And kids that are in foster care, absolutely, there is unpredictability and changes and a switch of caregivers. So what will often happen because of that is you'll see kids' behaviors absolutely change and ramp up. And what we get referrals for is the behaviors. But if we only look at the behaviors and try to stop the behaviors, we miss the whole big picture of why the behaviors started, what the behaviors are doing to help the child, even though we think that the behavior is absolutely hurting the child, and it may be, it's that they're trying to survive. So that's how we target the intervention. How do we help this child feel safe and meet the needs consistently so that they can shift how they view themselves and the world? And we do that through soothing the nervous system and rewiring the brain. Okay, let's talk a little bit about impacts. And I think I'm going to go through this part really quickly, but just understanding that it's not just the sexual abuse. It's that now we may be dealing with sexually transmitted infection. There may be physical injuries physical abuse along with the sexual abuse. There may be and which are going to lead to what I mentioned before, the higher risk for heart disease, obesity, cancer, and many other things, right? Increased risk of change in the environment, change in caregiver situation. That is a physical health consequence. Even though it might be for the best, it in the short term, the transition and the unpredictability and the lack of control is absolutely traumatizing. And then, of course, the mental health things that I talked about before, low self esteem, hypersensitive, or hyposensitive. That nervous system is tricky. So the hypersensitivity could be the fight flight, but the hyposensitivity could be the freeze. And every child is different. My son, he immediately, when there is threat or danger, whether it's real or perceived, will freeze. He can't help it. He wants to be able to kind of talk and voice and fight, but he can't. He just it his throat closes off and he just loses all sensation and gets dizzy. That's how his body responds. And for years, I've had to really talk to him and work with him on that there's no shame in that because he feels such shame in not being able to respond. But his body shuts down and there is no shame in that. Now, me just saying that doesn't fix it. It's taken us years, and I'll teach you how to kind of target different interventions. But just recognizing that, bringing that awareness out of the different stress responses. Okay. Distorted views of sex, distorted views of self and of others, mistrust, depression, body dysmorphia, PTSD symptoms. Okay. Behavioral consequences. This is what you're going to see. And oftentimes, this is what the referrals will say to you. Here's the behavior, here's the problem. They're fighting at school, they're missing school, they're manipulating, right? It's all this behavior focus. What I want to challenge you to do is set aside the behavior and just focus on what's underneath the behavior, fueling the behavior. And that's what I work with a lot of schools to do because schools typically are just working on the behavior, trying to stop the behavior. And I understand why, but what happens is the behavior often repeats because of that. We don't fix the behavior if we don't fix what's underneath the behavior. Oftentimes with sexual abuse, we will see behaviors such as perfectionism. Now, when I talk about that fawning as a stress response, these are kids that often do well in school. Why? Because they want to be seen as different. They don't want anyone maybe to know about the abuse or to talk about the abuse. They don't want to be seen as the abused child, so they will mask. They will be helpful, right? That's that fawning behavior. They'll appease and try to make everything okay. So we see a lot of perfectionism, especially in girls who have been sexually abused. And what happens oftentimes too, especially for these kids, is that they fall through the gaps because they look like they're doing great. They're doing fine. We don't need to worry about them. They're getting straight A's. And so if we only look on the outside at that behavior, we're not as concerned. But if we could really look inside and see what is happening, you would likely see a nervous system that is just in chronic state of stress. That child who may seem fine on the outside might just be flooded with adrenaline and that is what is fueling their perfectionism. They're just going, 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 not wanting to stop. That's the flee, right? Fight, flight, freeze. And so they're overachieving so that we don't have to worry about them. But those are the kids absolutely we need to be worried about. So watch for that. Watch for perfectionism and then work and talk to your clients about how they can still be loved and accepted in their what's the word? Imperfections, right? that it's okay to make mistakes, and we are human, and all of those things. I'm going to get into that more, but I feel like I can't say it enough, right? That we have to make it okay for them to not be perfect because it's impossible. So it's a huge setup for failure and for anxiety and other mental health issues. Okay, hypersexualization, risky behaviors leading to multiple partners, early pregnancy, things that could be so harmful, and increase of for future victimization. Oh, and I don't want to skip over this higher risk of suicide and suicide attempts. So I don't think I need to tell you all this, that the impacts of sexual abuse are so um, worrisome, and that we absolutely need to be aware and we need to get on top of it. Sometimes I'll hear, well, let's just wait it out, or let's not focus too much on it, or let's give it some time. We absolutely need to be so proactive at even the very youngest of ages. And there's different ways to do that with each age. My point that I want to bring out when we're talking about impacts is that the brain development is impacted and we can help that. Their inner working model and belief about their self can be skewed, and they may see themselves quite differently than the reality. Nervous system sensitized, and that you'll see behaviors, but I want you not to even necessarily use the word behavior, because when you see a child who is behaving badly, I hope you can see my air quotes, right? What happens to us culturally and biologically is that when someone is doing something that we have deemed as bad or wrong or hurtful, we automatically want to stop that, punish that, consequence that. But if you shift that from seeing that it's not a behavior, but a stress response, that that child is struggling and trying to survive, and the only way they know how is to fight, flight, freeze, or fawn, then your response will be different. If you look at a child who is manipulative or uncompliant or, hurtful or bad, then you're going to want to stop it and consequence it. But if you shift that lens and look at a child who is struggling, who is hurting, then you go, oh, I want to help that child. So it completely shifts our response. And we need to teach that to caregivers and to who else is working with the child, teachers, school, because that will shift their response to the child as well. That's the shift from punitive to trauma sensitive and being trauma informed. And then I think I also mentioned that if we don't understand all of that, that then we mislabel the child, right? We call them defiant, we call them manipulative, versus they are struggling, they are hurt, they are in pain. And I'm not saying that what they're doing is working or healthy or right, but it's the shift in our response. Then that shifts the behaviors rather than stopping the behavior, if that makes sense, right? So we have to understand that it's not that they won't listen to us, won't conform, won't be compliant, won't do what we're asking. It's that if they are detecting threat and danger in us or anyone else, then they can't yet do what we're asking them to do. So it's can't versus won't. And so that's why I spend a lot of time talking about what happens biologically with the neurotransmitters, with adrenaline and cortisol, because they're not in control of that. So if they're not doing what we ask and we're saying they won't do it, then we're completely re-traumatizing that child. But if we're looking at them going, they can't stop right now. They can't follow through with what I'm asking them to do yet. I have to get them regulated and soothed first so that they can access that top part of the brain. And I'll talk to you about that. The other thing I want to point out really quick is chronological versus developmental age. If a child has been abused or experienced other adversity in childhood, it delays their development. It delays their brain development and causes developmental lags. That means that they're not developmentally their chronological age. You may be looking at an 8-year-old and you may be thinking, and this happens in school all the time, I have a classroom of 8-year-olds. This is what 8-year-olds should be able to do, can do. These are my expectations for 8-year-olds. But if that 8-year-old has been abused, then they are not developmentally 8 years old. They are younger because of what happens in the nervous system and the brain. It causes developmental delays. And then in that case, you cannot have expectations for what that 8-year-old can do milestone wise. You have to come in younger and parent or caregive or treat them therapeutically at the younger age. Then we develop and build those skills. I'm not saying that we let go of all expectations, right? We have to get them there, and I'll teach you how to do that too. Okay, so again, and I just wanted to put this up here that our brains are wired for connection. When we're born, we are wired. That's that attachment cycle. We have to have other people help us. That's how humans are wired. And as we get older, as we grow, we become more independent, we become more self sufficient. True. But we are still wired for connection. That is the best way to heal, is through that safe relationship with others. So we're wired for the connection, for the safety, for the healthy attachment. But if there's been abuse, that is traumatizing and it rewires the brain and body for protection. That's the mistrust. That's what trauma does. It rewires so that instead of wanting that safe relationship and needing that, you push away or you fawn and bring in the unhealthy, unsafe closer, putting you at higher risk. It just skews everything. So that's why safe and healthy relationships can still be difficult, even though this is exactly what they need. I'm looking at all of you. You are what they need. Yes, true. You are the strategy. But that doesn't mean it's going to be easy. You are going to come up against a lot of mistrust. So just know that, because what happens a lot of times with us as therapists is after being rejected and after like it just not working, you're trying so hard, you're working so hard, your intentions are so good, you're doing everything right, but it's not working. After doing that over a period of time, you get burnout. You completely get traumatized yourself because you're wired for connection, and being rejected constantly is very harmful. So we have a lot of therapists in this field who are burnout, who are experiencing secondary traumatic stress because they are hearing the trauma day in, day out, and they are internalizing it. And we can experience PTSD symptoms because of it. I'm going to hopefully get and rush through this so I can get to that part 2 on how to help ourselves so that we can better help our clients. But you just have to know that and understand why. So knowing that that trauma has rewired these kids' brains, and now that's why they're maybe rejecting you or doing behaviors that don't make sense, even though you're trying, they're still self-sabotaging. Knowing that this is why and it's not your fault will help you to continue to go, will help you measure things in baby steps. Because at least for me, I wanted to see big changes. I wanted to see growth. I wanted to see healing. And I wanted to see it quick. And after doing this work for a long time and not seeing it, I kind of got into this all or nothing where I'm a failure. Must seriously suck at my job. I thought I was going to be good at this. I'm terrible at it. And I would go down that rabbit hole. And then I was burnt out and I didn't want to do it anymore because I really saw myself as a failure. But now understanding it, I can go, wait, stop, and measure progress in minute baby steps and not have expectations of what progress looks like, but instead look at it. And even understand that sometimes regression in a child is actually progress because when we're talking about brain development and having lags in development, we can't skip development and milestones because that child is 8 years old chronologically, but they might be 6 years old developmentally. We can't just skip and get them to where everybody needs to be. We actually have to reverse and regress and start at a 6 year old age and develop and scaffold skills to get them to that chronological age. Well, that looks like regression. And regression is also super hard on a therapist. We feel horrible when we see regression. So I want to reframe that and have you understand that because of developmental lags, regression is progression because we can't skip steps. We have to go back and get them to where they need to be. Okay. So I want to show you this iceberg. What you're going to see with behaviors is the top of the iceberg. If you think about an iceberg, most of the iceberg is underwater. And we forget about that. And we only see what we see. And then we just want to stop the lying and stop the sabotaging and stop the harmful sexual behaviors. We want to stop all the things that really are upsetting for us and even triggering for us, right? But if we just focus on what we see, then we don't heal. We have to look under the water and see what I really need to heal is this child's feelings that they're constantly being rejected, that they're feeling shame. Most of the behaviors that we see are fueled by shame and fear. So if you can work on helping them feel safe physically and emotionally and pull out that shame, then those behaviors on top you'll see less. And I love this next quote from Dr. Bruce Perry because I've spent a lot of time talking about adversity in childhood being at higher risk for predicting health problems, emotional problems, and mental health problems. But what he says is actually what's a better predictor of health is not the adversity, but the safe relationship, our history of connectedness. So if we can surround these kids with positive, safe relationships from the therapist, from the school teacher, from the caregiver, whoever, that will better predict their wellness. So that's what the focus is from me to you is I'm going to spend all the next talking about relationships, safe relationship and strategies, how to do that and understanding how to create that trust and build that trust. Because relational trauma, and that's what abuse is, if a certain relationship has been traumatizing, how we heal that trauma is in different relationship with that therapist, that positive, safe caregiver, that teacher, whoever that adult or adults are who can surround that child with physical and emotional safety. Attachment is the antidote. And that's why I talked about the attachment cycle. So um, repeated interactions of unsafety cause that break in attachment and the trauma, and how we heal that is repeated positive interactions of safety, consistency, predictability, structure, and routine. Those all feel safe. And it really has to be done in relationship. This child cannot heal on their own. And that's actually true for adults too. We heal better, quicker, faster, stronger through safe relationship because that is how we're wired from birth is to connect with others. Isolation, it's like the equivalent of starvation. Loneliness is the equivalent of starvation. We always need others, right? So, um, people die of heartbreak. They die of being alone. We have to have safe relationship. That's how we heal. That's how our brain is wired and our nervous system. So, how do we do that? And I think a lot of this you're already doing and you're already aware of. So this part I'm going to try to move through really quickly, but we have to be absolutely non-judgmental. And that's why I started off talking about um, because an event happened, we don't say, well, that wasn't a big deal, right? And we have to talk about that openly with that child because they may have been told that from others. So we have to explain what happens in your nervous system in your brain, that it's not big or little, it's not small or large, it's what it is and how your body reacts. And we have to allow space for that, um, and be very comfortable with silence. I want you to get really comfortable with silence and understand that if that child doesn't answer or if it is silent in the room, it's not that they are not understanding. It's that that could be a stress response. And we have to allow the stress response and work through that stress and complete the cycle, not stop it. So, for example, and maybe you were taught this in school. I was always taught this that like if you're with someone and they're crying, if you offer them tissue, they'll stop crying. And even though we want to comfort and we do that with a tissue, if we stop the crying, we've actually stopped the processing. So having tissue available is fine because they know that they can use the tissue, but we don't want to send the message. We want them to stop crying. So that is what I'm saying about the silence. We have to allow the silence, allow the processing, and if it is a stress response, if they're in freeze, we can help them move through that. So getting comfortable with that. And then huge and big, and I know you all know this, but we have to be so honest. We cannot make promises because we are out of control of what we can actually complete with promises, right? And it sets us up that we would break a promise. And if you're working with a child who has been sexually abused, they're already really struggling with trust. So the honesty is everything, and the not breaking of promises is everything, right? And the other huge thing I also always want you to keep in mind is that need for emotional safety. And so honesty, transparency, and creating an environment where they can trust you will help their nervous system be soothed and feel safe. Okay. So that means we also have to kind of watch our reactions. And I will tell you, as a new clinician, I was not prepared for some of the things that I heard, some of the things that I saw, some of the behaviors that I experienced. As a child abuse investigator, especially in young children, where they might not be able to verbalize what happened. And so we would have them, of course, just draw if they felt comfortable. I was not prepared. And I absolutely had to keep my self in check, right? Um, I and that was a skill that I had to practice and learn, not to make certain sounds that the child was trying to read me on, right? So, practice that, just being aware of how your body language is coming across. Is it coming across as judgmental? You don't want to be arms crossed. You want to be open and safe, um, so that you can respond, with empathy so that they can share whatever needs to be shared, right? So that comes with that transparency of you being really um, clear as you can, depending on developmental level, not depending on chronological level, but whatever developmental level that child is at, explaining the process, explaining what will happen next, what you are in control of, what you don't have control of, because the more you do that, that gives them control, the more collaborative that they can be in that. So just be aware of that. Okay. And then creating that physical and emotional safety can be done by how you're interacting. So when you're teaching safety, whether it's preventative or after the fact moving forward, you know, what is safe to do in your office and in other areas, and talking with the teachers about that, right? High fives and fist bumps and all those things are so great. You have to be so, of course, careful with hugs and all of that. And I think that you know all of that, but it's just so good to point out. So educating not just yourself, but who else is surrounding this child, what are safe practices and not invasive. And even though I have to really kind of watch myself, I'm a touchy person. I want to hug or I want to just put my arm around someone, but understanding when that is absolutely not acceptable or okay, right? It's not about me and what I need, it's what that child needs. So, ongoing training about this, especially for new staff or new people who are interacting with the child, we can continue to teach this. And then, especially in the school, providing safe spaces like, well, actually, that's in the next part. So we'll come back to that. This part, what I wanted to talk about is just our facial expressions and understanding if I don't know if any of you are working virtually with a child or a caregiver or anything, but especially when it comes to sexual abuse and the mistrust, there are things that trigger them differently. So, for example, if you're working virtually, avoid using any filters, or you know how if I wanted to do a different background, I could put a different filter on. That actually can be very triggering for someone who has been abused. And they may not even recognize or understand that. But what happens is you're wondering what's really behind the background. I know that that's not a true background. I know that's not what is really going on. So it triggers this mistrust. So you have to be very careful with backgrounds, what can be seen, what not can be seen, and filters. It's all about transparency and honesty and openness, and you're conveying that. And virtually, it can be really tricky. So just be aware of that too. Okay. I am worried I'm going to run out of time, but I wanted to go over this really quickly with you. Okay, I'm just going to give you really quick on the brain because I want you to know where the child is at in their brain. Here's all you need to know: upstairs and downstairs brain. If the child has been abused and is triggered, they are in their downstairs brain. And the only thing that they can do in that downstairs brain is survive, fight, flight, freeze. So if they're dysregulated, which just means they're not able to be soothed or calm, then they're in their downstairs brain, and that's the fight, flight, freeze. Our goal is always to get that child in their upstairs brain. What happens in the upstairs brain is you can reason, you can reflect, you can talk, you can problem solve. We need that, especially in school, right? So you need to understand more than likely, and especially in therapy, because it can be super scary at first or ongoing to be in the control of a strange adult or just an adult. There's a power differential. They're in their downstairs brain. And so here's what what to do. That upside down pyramid, upside down triangle is that brain that I just showed you. Downstairs brain, upstairs brain. In the downstairs brain, that child needs to have their nervous system soothed and regulated. That's that bottom. So what I'm saying is that you're coming in at the bottom and you're moving them to the top, because remember what happens at the top. They can process, they can think, they can heal. That's that part of the brain. So how you do that is you soothe the nervous system first through that connection, that relationship. When they trust you, then they can relax and be in the top part of the brain where they can reason. How do you do that? Well, first, I always say Movement is the quickest, best, most efficient way to release that adrenaline and cortisol. Can you do activities in your office or a walk and talk or regulation tools? We'll get into that, but I want to show you a calm kit in a minute here. So, games, play. So, before you even get to the talking piece, you're regulating first. And you can do that through movement. You can do that through fidgets and regulation tools. You can do that through games um, and not rushing. That's allowing for the silence, like I talked about, and giving time. Once they are feeling like they can open up and trust you a little better through your support, you're validating, right? Connecting, you're just listening. You're not talking necessarily. You're just being there for them, letting them kind of control that feeling. Then, once they are moving up to that top part of the brain, then you can ask questions, right? Then you can talk about proactive things. Then you can um, discuss if necessary, right? But that's what happens the very last. So, other ways to do that, being present, which I think you're probably like, well, yeah. But what often happens, especially if we're on the phone or behind our computer, is that it doesn't feel present. So that can mean this person is touching. I'm not necessarily advocating that. I would say adjacent or eye contact. If eye contact feels comfortable, sometimes it doesn't. But it's that ability to reflect your nervous system state. So when we're talking about regulation and co-regulation, we have these neurons in our brain called mirror neurons that reflect each other. Basically, that means emotions are contagious. If you're calm, and I don't necessarily like the word calm, but to me, calm means regulated, steady, safe, right? It doesn't necessarily mean that you're not having energy, because I also talked about how important movement is. It's the kind of energy, it's a nervous system state. If you can reflect that, then that is contagious. So you're the strategy. How are you coming across? Have you had a hard day? Are you doing okay today? Are you angry? Are you irritable? Have you eaten? Because for me, right? If I haven't eaten, if I haven't taken care of myself, I'm not okay. Well, that matters. So, how you're doing will reflect how the child feels. So, and then that holding space for that behavior that you might not want, not rushing to stop it, but rushing to understand what's underneath it, getting really curious. Why are they yelling at me right now? Why are they spitting on me? Why are they throwing things? Okay, I know it sounds ridiculous that I can say, let that go. But what I'm saying is before just yelling stop and making it worse or pouring gasoline on the fire, you've got to be soothed yourself and have that structure and boundary of we have to have safety here. That's if it's in a fight response. If it's in a flight, it's providing that safe presence so they feel able to come back. Because sometimes flight just looks like the hoodie over the head. I don't want to talk to you. And it's okay to allow that and allow that safety and that silence, right? We're doing this in a neurosequential order. I have been involved in group sessions or sessions where a therapist has said, "Hey, you're here to talk. I'm answering questions. You need to answer them." Guess how well that worked? Didn't work, right? So that's what I'm saying about holding space. Okay, I'm gonna try to move along here. Um, okay, so remain present, get curious, check in with your emotions, listen. I'm one of those that I just have a lot of great ideas and I want to talk and I want to solve it and fix it. And I've really had to learn to really shut up and just pause and get curious and to listen and attune to what this child's needs are, not what my agenda is. Which means I make a lot of mistakes and I want to give you I want to give you permission to make a lot of mistakes. That's okay. because when we make a mistake, it's super powerful to apologize for the mistake and model, I'm not perfect. I made a mistake. Here's how I'm going to fix it. I'm going to apologize to you and see if we can start over again, right? So practice, 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 and model how to fix mistakes. That creates emotional safety in the therapeutic relationship. And oftentimes, you've got to be so aware of your own emotional state that you might need to take a break. There, you will see behaviors that will trigger you and will dysregulate you. If that happens, know that that's okay. That is human. That is normal. And then what do you do next? You might say, I need to take a bathroom break. I need to get a drink of water. Do you want to go on a walk? I need to walk this out. Whatever it looks like, it might be different, but I'm giving you permission to absolutely be human, make mistakes, and take breaks. Okay, let's get into some strategies. Here's what um okay, I mentioned to you that you need to know upstairs brain, downstairs brain. 99% of the time, I'm going to want you to do bottom up strategies. A bottom up strategy is that you're coming in that bottom part of the brain. Remember what that bottom part of the brain is just about survival. You're going to start at the bottom part of the brain and work your way up. A top down strategy is where you're starting at the top of the brain and you're working there. The top down strategy would be like, can you journal about what happened to you? Can you talk to me about what happened before this event happened? Can you write a reflection or talk to me? If you're asking the child to talk, 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 that means that they need to have the skills and abilities to reflect and to reason. And those are not bad things. And those are healing things to reflect and to reason and to use logic. But 99% of the time, the child cannot do that yet because they're developmentally younger and they're likely working in the bottom part of their brain. These kids are so hyper vigilant and detecting threat and danger everywhere that the adrenaline and cortisol is coursing and they can't reason, they can't reflect. So we have to start at the bottom with a bottom up strategy. And then if we do need to talk, we can do that once we have gotten to that part of the brain. So sometimes I'll say, you need to know where they're at, and then you need to figure that out, and then you need to do that. Well, if that sounds overwhelming or stressful or that you can't figure that out, good news. Just start at the bottom. Always start at the bottom. The more you do that, the more safety, emotional safety will be created, the more trust will be developed, and you'll get to the top part faster. And the truth is also that if you're working with young children, you don't necessarily need that. Healing doesn't have to be done in that top part of the brain where you're reasoning and reflecting. A lot of healing can be done in silence and because we're healing the nervous system in the brain, right? So that's all going to be happening through the bottom up. So I'm not saying the reason I said all that is because I'm not saying you can't do top down strategies. You can't, but I just don't want you to focus on like cognitive behavioral therapy. That's not necessarily going to be effective. But things like EMDR, right, or these regulation and co-regulation strategies, those are going to be more effective, especially with children and especially with children who have been abused because they're developmentally younger. So, all that to say, here is going to be your most effective strategy is this reset process. What does this mean? It means that you're going to, if you can, first move the child. That's the walk and talk. That's if you have things in your office like a trampoline, a mini trampoline, right? Or stretch bands, or I'm going to show you some of these in just a second, but things that get them moving. handprints on the wall where you can stretch and move and do, wall push-ups, not as a punishment, but as a large motor movement, because that pushes out the adrenaline faster than anything. Remember, we have to complete that stress response cycle. We have to get rid of the adrenaline and cortisol, and we can do that through movement first. If it's not going to work to move, and it won't always do that, then you can do smaller movements like um, create creative games and fun, even crafts and drawing, deep breathing, grounding exercise. It's a form of movement, but in a much smaller way, and it still will push out the stress hormones. It's just that movement pushes them out so much faster. It's just more efficient. It's more helpful, but we can't always do that. I get it. So that's why I'm going to show you other ways too. So if you can move first or do the smaller movement first, then that activates the thinking. So really what it's doing in a quick way is moving you from the bottom to the top. Once you can get that activated thinking going. So let me give you an example. I think it'll help if I give you an example. One of my favorite examples is, and this is what is greatly instituted in, should be greatly instituted in schools. Okay, if a child is behaving in a way that the teacher wants the child to get out of the classroom and send them to the principal's office, this is what should be done next, or in school suspension, right? Okay, a grounding technique first or a movement technique. So I saw this happen so beautifully and perfectly that I just would love to replicate this. My friend, Dr. Springer, who's a principal in Kansas, this is what he does with his kids. He's the principal, and he immediately pulls out the Legos and gets on the ground with the kids. There is no talking happening. Hey, let's play some Legos. They're on the ground, they're on their stomach, or they're sitting, or their back is pressed against the wall. Then they're playing Legos. He might offer them a drink of water or a sucker or a protein snack, whatever is appropriate and available, a snack, and then they're working with the Legos. And then what often happens is that he'll see a physical shift. They come in, they're nervous, they're scared, they're not talking, or they're belligerent, or they're angry, right? So many possibilities. And then he's like, let's get on the floor and play Legos. And then he sees the shift. Once he sees the physiological shift, he says, hey, happened today? Tell me about it, right? In an open, the tone, the volume, the cadence of voice is friendly, is welcoming, is soothing to the nervous system. Okay, why does he do all that? And this can be absolutely replicated in a therapy office. Down on the floor, and you could even put in the chat, and I should have asked you to do this before. What are all the little pieces here? What are all the little strategies and things that he is doing that is causing that physiological shift? Because while you're putting those in the chat, what he could be doing is saying, why did you do that? Times do I have to tell you not to throw a chair? What happened? What, why? And I did this as a mom so many times when my kids would misbehave. Why did you do that? Well, guess what their answer was? I don't know. Or no answer. Do you remember my son that I told you would go deer in the headlights? I would say, why did you do that? And he would look at me with that blank face, right? And it would kind of really make me mad. I asked you a simple question, give me a simple answer. And again, no answer. And that would make me madder. Well, come to find out, after really, it took me a long time, guys, to realize that was a stress response, that he was freezing. I was the bear. Anytime I would say, why did you do that? What's wrong with you? Why can't you do whatever? I was the bear. Okay. So that could have been the response. Now let's go and see what you've got here. Let me see if I can find your answers. Movement. Yep. Creating a sense of safety. Allow the client to ground. Absolutely. Sitting on the floor, it allows them to get in their thinking upper brain. Non-judgmental space. Absolutely. Okay, the grounding is very important, and you can ground in many different ways. Physically grounding, sitting firm. My son gets really dizzy, so I will often say, lean against the wall, sit firmly in your chair with your feet planted, or sit on the ground, or lay on the ground. Okay, grounding. Grounding works really good for children and students who are in freeze because there is a disconnect when you're in freeze and it brings you back in because you have to be physically aware of your surroundings. Okay, grounding. Playing. I can't underestimate the impact of play. Why? Because play shifts you. When you are dysregulated, your brain will often, when it freezes, stop talking to each other. So you've got your two hemispheres and they're not connected. Play will reconnect them. So, you know, play is it's easy to play, I think, with our younger kids, but if you've got a teenager, that's gonna look a little different. It can be joking, it can be doodling, it can be drawing. It's play is it's not just a, uh, noun. It's an act, right? It's that you're doing something inside as well. It shifts you. You can't be having fun and scared at the same time. Does that make sense? Your brain cannot play unless it feels safe. If you feel safe, you can play. So playing will get you out of the state of fear, out of the shame. So when he walked into that office and the principal didn't say you're in trouble, but said, let's play, that said, you're safe. And then it's not that he was letting that child get away with bad behavior or, it's that he couldn't reason and talk to that child until they felt safe. So once he saw that physiological shift, the child moved from the downstairs to the upstairs, and then he could say, tell me what happened today. Let's talk about it. Okay, very good. So the other thing that's on the screen here is a pulse oximeter. A pulse oximeter is a great tool to measure heart rate and oxygen, and you can use it as a game that teaches the child when you're dysregulated, when you're in fight, flight, freeze, either your heart rate will be elevated. If you're in fight or flight, your heart rate will be elevated and your breath will be shallow. If you're in freeze, your heart rate will be slower, right? So when a s when that, child comes into your office and you can say, "Let's see what your heart and your lungs are doing right now." Okay, and then you write that down. Now, let's see if we can change that. And then you can do a deep breathing technique, a fun deep breathing, I'll show you some, and that will change the oxygen. It will also change the heart rate, and they can see it, they can measure it. So if that child is in that calm state, oftentimes that heart rate will be between 70 and 90, and that's how you know the child is regulated. Now, that's not hard and fast, it depends on the child, but it teaches them they can control their heart rate and their breathing, and control is everything for these kids. And so then also when you're not there, you can say, now, if you're feeling dysregulated or stressed or worried or whatever the feeling is, anger, all feelings are welcome, right? Feelings are just feelings. Feelings aren't good or bad. Anger isn't bad. There's a reason the anger is there, right? It's not the feeling, it's how we manage the feelings. That's regulation. And we can teach children how to regulate. We do it through co regulation, we model it. So if they feel safe with us and we teach them, when you're not with me, whatever feeling you're feeling, frustration, overwhelm, you can do a deep breathing technique. You can do a grounding technique, all the different things. Okay, I'm going to rush through a couple more strategies for you. If you're familiar with EMDR, you might be familiar with Happy Place. I'm not saying that if you're not EMDR certified, I'm not saying you should do EMDR. You can modify some of the techniques to help a child feel safe and soothed by creating their own memory or recalling a fun, safe, peaceful, happy memory so that they can do that on their own when they're not with you. There's lots of different ways to create it, but it will help soothe them if they can recall and imagine a safe memory that helps them feel peaceful inside. Um, so that is one strategy you can use. And other strategies, deep breathing strategies. I'm going to give you a link to look at my books that have a million strategies that you can implement. There's a lot of fun deep breathing ones. This one says 478. Visualizations like dialing down the worry, visualize changing the level of strength and power of the worry, having control of that. That's that dial it down visualization. Butterfly and dragon wings is tapping. So you can model if they want to be a butterfly or a dragon, they can flap their wings. Anytime that you're doing anything repetitive and rhythmic, that will soothe the nervous system. So that's why tapping is really good. Um, if they want to do it in a way where others can't see them. So, like if I'm working with a kid at a school and they're feeling dysregulated in the classroom or they're worried about a test coming up or whatever, I'll say, you can, under your desk, put your hands on your thighs and pat them. And no one will know, no one will see. And it can be very small movements, right? Or even under the desk, you can bilaterally um, snap or pinch or just tap like this. That will soothe and calm the nervous system, right? Okay. And a self hug will do the same. Also, with the tapping and the self hugging, you're crossing the midline of the body so that you're crossing hemispheres of the brain. If the brain is not communicating and you're feeling fuzzy, foggy, you can't remember, cross the midline of the body and it will cross the midline of the brain. So the tapping, the self hug, which works also really good because we're not hugging these children. So you teach them, hug yourself. It sends the message of care and love and it provides proprioceptive input, which sends the message of safety because it gives pressure and it crosses the midline. And the longer you hold it, the more positive neurotransmitters are released. So when I talked about adrenaline and cortisol, the other way to chase out the adrenaline and cortisol is by introducing dopamine, serotonin, oxytocin, and endorphins. The movement introduces the endorphins. The compassion, the self-hug, the tapping, that introduces oxytocin. Um, they all introduce the the hormones that soothe and chase out the adrenaline and cortisol. Okay. Oh, I gotta watch my time. I know I'm running out. Okay. This is a idea for creating a safe space. You can do it in a portable kit, or you can do it in a grander scale of like a safe room. Like at some schools now will have things like a Zen den or a peace place, right? Those are regulation rooms or reset rooms, amygdala reset room, right? I've heard it called so many different things. You can do it in a grander scale in a room, or if you don't have that ability, you can do it in a portable kit. And this works really good for therapists who are traveling to the school or traveling to, where, or you want it in your car. And mine is called a calm kit. And I don't necessarily even like that word because I don't want kids to think that I want them to calm down, right? Because that is so shaming. What I like to explain is that calm is just a nervous system state where you feel safe. So I don't know that you want to call it a calm kit. That's just, I've called it that way for so long. That's what I call it. But you can call it, your safe space or your fun box, whatever. I'm going to stop sharing for a half a second just to show mine. Um, this is the size of it. It can be anything. It can be a basket, but it is full of regulation tools that have a lot of different sensory, tactile things fidgets and things to touch because that soothes. You have to engage that sensory system. That sensory system is in that bottom part of the brain. I'm talking about bottom up strategies. You want to engage the senses. So lots of different things that provide sensory and tactile sensation. And you want a lot of different ones because what feels good for one kid doesn't for another. This is like a silicone sponge and feels really good to me. I love to fidget with it, but my kids hate it. They feel like it feels icky. So you want different textures because different things feel different to different people, right? Okay, this is like a stretch band. So remember, I'm incorporating movement, but I'm always doing it in a fun way. It's a game. It's fun. How many can you do? How many can I do? Oh my gosh, you're stronger than I am, right? It is not ever like a punishment or a reward. It's just teaching how to soothe the nervous system. This is a kick band that goes around the chair in the classroom or wherever so they can move all the time because kids should not be able to sit still. That sends the message of unsafety. That's why recess is so important and movement all the time, brain breaks all the time. Okay, there's also kind of some snacks in here and my pulse oximeter, breathing fun things like a pinwheel and bubbles. Those are ways to engage the deep breathing. If you want to reach out to me and ask more questions about this, please do, because I feel like I am rushing through this and not spending as much time as I want, but I just, we need 5 days and we just don't have that. So please reach out to me if you want more questions on the Calm Kit or the safe space. Here's kind of a fun shopping list. Go to, the Goodwill or garage sales. You don't need to be spending a lot of money. And so I can give you information on that. Okay, few more things as we move through here in these last few minutes. Okay, come on. There we go. Okay, predictability, routine, and structure will go so far in creating that safety. If you can do nothing, just create that. We call it felt safety because the nervous system senses safety, then will send out the message of safety. It has to start internally. So predictability, structure, maintain a consistent schedule, right? That will reduce anxiety, visual schedules, clear transitions. Keep in mind, these kids are going to be younger. So it's okay to really use a lot of visual schedules and what's going to happen next so they can see it and hear it. And talk to the teachers about that, right? Schools are actually really good at being predictable. They have those schedules and they stick to them. It works really good. I would also see if they can, it's good to get the school involved so that there is that team, so that they have access to mental health when you're not there. Can they go to the Zen den? Can they go, to talk to someone if they need it? Foster inclusion and I keep going back to this whole relationship and that they're wired to connect. If you can do groups with kids, now this all depends, right? But groups can be so powerful in sending that message. I'm not alone. It's not just me. I feel others feel this same way. Of course, keeping in mind confidentiality, but peers and groups can be so powerful. Fostering empowerment, giving the child voice whenever you can, and validating. Of course, not that you shouldn't feel that way, but I hear that's how you're feeling. I understand that is so powerful. Offer mechanisms for communicating distress. I don't really have time for this. So, what I'm going to do is tell you and you can come to me and I'll tell you as well later or and it's in my books too. But the hand brain model by Dr. Dan Siegel gives common communication where everybody's on the same page of how you're feeling so that they can just signal you and let you know how they're doing without having to explain it. So look up the hand brain model. It's also in my book and you can watch videos on how to teach it and use it. It's been such a powerful tool in my work. Okay, not asking for details and being transparent and honest. I think we've talked about that. Um, and one thing we haven't really touched on, and I'm probably just going to quickly go over this, but and not spend time here, but that we have to also look at what's happening outside of our therapy office in this child is what's happening at home. If, you know, supporting that non-offending caregiver um, is going to really make a difference in it'll improve the outcome and improve the success and the healing of the child. So how can you do that? What does that look like in your office or if you're not working with that child, making sure that that non-supporting, non-offending caregiver is supported. That's going to be everything. You know, I learned really quickly that 1 hour of therapy a week in my office is just not as impactful as the 24/7 that therapeutic parenting can do or trauma sensitive school environments can do. I only have this child for a very small time. So the bigger healer is a therapeutic parent, which doesn't mean they have to be a therapist. It just means a healing presence, a safe presence. So we have to support that other caregiver, right? And I talk a lot about the schools because that is where the child spends most of their time is at home and at school. So can you bridge that gap and work with the school and help them create a therapeutic environment for that child? So support for the non-offending caregiver, looking through a trauma-informed lens, providing emotional support, honesty, transparency, and education. So I know I'm not giving this enough time, but thinking about that. And then, of course, being aware of cultural factors. If there's language barriers, that has to be addressed because that will absolutely impact their access to services. You're going to be doing networking and referring to services outside of your capacity. Can they navigate and access services? Well, we've got to figure that out and find what barriers there are to receiving that. Especially in certain cultures, there will be stigma. There may be an impact on how they view roles of mothers and fathers and who can and honesty regarding all of that, right? If family cohesion has been disrupted because of the abuse, culture will come into play. So understanding what their cultural norms are, what their cultural expectations are. How many times have I sat in a room? I used to work with the Paiute tribe in southern Utah, and I just thought that I knew everything and I was giving all these directions and saying, "We need resources, we need support, we need to do this," and they would smile at me, and I thought, "Wow, look at all the good that I'm doing," and then come to find out later, they were not going to speak to me or listen to me or follow through because of certain cultural barriers, and because I obviously did not know their culture enough to recognize, um, power differentials and how I was coming across as a young white woman. I was offending them and didn't even know it. So be aware of that and lean into that and learn about that. Okay. I do recommend, as far as your therapeutic interventions, EMDR, trauma informed CBT, family therapy, not just treating the child alone, but treating and I've mentioned this a million times, the school environment and the family environment, which sometimes is harder than others. I get that. Going from a strengths-based lens and then involving community support, whether that be through groups or peers, but you're going to want to channel resources in your area. And I have sent Sadie a whole bunch of resources in California that you can utilize as community support. So look at those. Okay. As we wrap up, I want you to just be aware, and I talked about this at the beginning, that kids will block your care. They'll have that mistrust. Don't take that personally. What really helps unblock the care is therapeutic dosing, which means small moments of positive interactions and moments of safety will build and accumulate. This was really hard for me because I just wanted to help and fix it really quickly and had to realize it has to be measured very small. So don't underestimate your presence and a fist bump and a look that just shares, I'm so glad you're here. I see you. You're safe. Therapeutic dosing will slowly unblock the blocked care. Otter buddies and anchors, I don't have time for, but I don't think I can do it quickly. But it's comes down to relationship. Otters raft together, they lean on each other, and they just know that they are safer together. They can ride the waves and the storms and the winds safer with someone else. So find who that is for you as a professional and for these kids. Who are the safe relationships in their lives? Who anchors them, roots them, keeps them safe when the winds and storms come? The PACE model is a model by Dr. Hughes that talks about being playful, which I've talked about, accepting, not rushing to stop the behavior, getting curious, figuring out what's underneath the behavior, and then having empathy for the struggle because we all have tough things. It's not about comparison. It's that um, there is safety created when they know you have made mistakes too. So be vulnerable that way. Completing the stress cycle, that is all about getting the adrenaline and cortisol out and introducing the serotonin, dopamine, oxytocin, and endorphins through all the different strategies that we introduce when we start at the bottom part of the brain with sensory techniques, grounding, breathing, and safe relationship. And then the community care is about that you cannot do this alone, and the child cannot do this alone. So, who are the others that will help heal? Because our goal for this child is resilience, getting through and healing and being able to, when they encounter the next hard thing, being able to survive it. We're not born with that ability. It is grown and developed and scaffolded through safe relationship. So you're the strategy. Harvard tells us that the single most common factor for resilience is at least one safe, stable, committed adult. And it hopefully is the parent, but we all know it's not always the parent. That's not always possible. So who is it? Is it the coach? Is it the teacher? Is it the neighbor? Is it the grandparent? Is it the therapist? We can build resilience through that one safe, stable relationship. I know I'm out of time, so I'm going to skip this next part, but this next part is about you understanding you're at risk for burnout. And so you have to complete the stress cycle for yourself so you can be the strategy. Here are different ways and having self compassion, being kind to yourself. And we model that for these kids. And then not just putting on your own oxygen mask, but actually what you're doing is going underwater. You're a deep sea diver. You need equipment, training, skills, support. Um, you can go underwater. You've just got to do it safely. But that is how serious this work is. It's not just a quick fix, it's ongoing support for you. So you may need to ask for help and get professional help for yourself. Be creative, find different methods of support because you are a co-survivor and you need just as much care and support as the survivor because of how hard this is. So I want to leave you with that. Here are resources and you'll have access to this. And then I want to end with another resource, which is my books. And I would love to give a few books away today. So I'm going to give away 3 books and Sadie will get you in touch with me. But if you would like to, I'm going to pick a number between 1 and 100 and put your number that you'd like to guess in the chat and the 3 closest numbers I'll give away a book and Sadie will get a hold of you for your information. While we're doing that, I want to offer this podcast as a support as well. It is trauma sensitive school information and therapeutic parenting information. So it's a great resource for you to give caregivers because we talk a lot about therapeutic parenting and how to create that safe space in the home as well. It's called Regulated and Relational. That's my podcast. Okay, I'm going to stop sharing my screen and we'll pick the winners and end here. I'm so thankful for this time today. I know that I just can you imagine? And I didn't even get to questions. I'm happy to stay on and answer questions. I don't know what your time frame is, and you can also reach out to me through my email and ask questions as well. All right, let me get back to these. Okay, so um the number was 1. So
Oh.
whichever 3 are closest to 1, you might have to help me, and if we have duplicates, I haven't really looked. Oh, I'm so
I
sorry, Katie, that you chose 99. I really apologize. That doesn't seem fair, does it? But we do have a 3.
think
We
we
do
have
have
Jennifer
a
Nielsen
13. I'll let you work on that.
and then Madeline and let's see, Desiree. Desiree. All right. I'll be contacting them to see which book they would like.
That's wonderful. Yeah,
Yeah,
and I can, contact you and explain each books in case you were looking for something in particular. So, and I'm always happy to come back to and do more because I am happy to do
everyone's asking for a part two.
that. And I didn't check for questions. So
Yeah,
if there are questions, let me look at that and or email me and we can look at that as well.
does anyone have any questions while we still have Ginger? All right. Well, I will be emailing everyone right after the symposium with all the PowerPoint, the resources, and the recording as well. And we really appreciate you all attending today. Ginger, you were amazing. Thank you so much.
Thank you all for the work that you do. Keep going, keep going.
Thank you, Ginger.